Good morning. Thank you for joining to learn more about your Annual Enrollment 2021 benefit offerings within Global Outreach Charter Academy. We know that you are focused more on your benefits now than ever. Now is a great time to review all of your elections being offered to you and make the best decisions for you and your family for desired coverages. So let's get started. The benefits here to support you include physical, financial, and emotional. I will highlight all the plans that you see here on your screen so you can make the best decisions for your family. For physical, we will review your medical, dental, vision, short-term and long-term disability options, along with voluntary plans through MetLife. With financial, we will review FinFit, which is financial wellness, Working Advantage, which is our employee discount program, the ability for you to sign in to the flexible spending account. From an emotional perspective, I will review your employee assistance program and then balance care. To start with your emotional support, we offer an employee assistance program to all employees. This is provided free from your employer. It includes you and all of your dependents, available to both full-time and part-time employees. Within this program, you have access to counseling services, 3 visits per issue per family member. It is 100% confidential, and we highly encourage you to make appointments should you feel the need to talk to a counselor. In addition, we also offer personal assistance, where we can assist with travel coordination, such as a place to stay, where to visit, what to do in the area, based on your family members. They can assist you in locating child care providers or elderly care services. There is an online personal profile that you can create within the website to give you access to additional life resources and training courses to give you more balance between your home and work situations. There is a health and wellness initiative where you can have 3 visits with a wellness coordinator who can help get you on a plan for better health. That could include losing weight, getting more exercise, whatever your future goals may be. You have access to a 30-minute legal consultation and referral service as well to answer some of those basic legal questions. Here's the phone number and the website to learn more about this program. Financial Health Advocacy Services is with a vendor called FinFit. This is also a free tool for you to gain more financial health for you and your family. This website allows online education, helps you create a budget. There's various tools and resources to improve your credit scores. If you need to access a short-term loan, this is also available within the program, and then those loan payments are made via payroll deduction, so super easy and convenient for you. To activate your free membership, you'll visit the website or phone in for service. With the Paychex PEO, we also offer you Working Advantage, which is just an employee discount program. You have access to shopping opportunities, restaurants, hotels, rental cars, movie tickets, theme parks, all sorts of opportunities that you can purchase online. This is done via bank or credit card deductions and charges. It is not through payroll deduction. You'll see the website and the phone number that you can call. These opportunities change all the time, so please do check them out often, and it is available to both full and part-time employees. As you go along with Paychex, please make sure that you have downloaded the mobile app. This will allow you additional flexibility to have everything at your fingertips. This would include paycheck stubs, W-2s, your 401k balance, along with benefits. You can easily enroll into your plans on your smartphone if you wish, or you can certainly use a computer. Now let's dive into your benefit offerings. These will become effective January 1st of 2021. This is your opportunity to review all of the plans being offered to you by your company. The only time you can enroll into these benefits is now during annual enrollment or if you experience a qualified event during the calendar year. So it's really important that you take the time now to make sure you're enrolled in the plans that you need to benefit yourself and your family for all of 2021. Remember that our benefit style allows you to select coverages based on each plan. So for example, you could elect employee-only coverage for medical, family coverage for dental, employee spouse for vision, or any combination of those, and it will be fully covered and available to you. So certainly select as you desire. Let's dive into your health plan offerings. The coverage will stay with the carrier Florida Blue. To highlight some of the offerings by the carrier, you have access to a health assessment online. There's additional lifestyle improvement programs that can even earn you money by signing up and participating. So definitely check those out. You get a monthly health statement where you can see how you're utilizing your insurance, the cost out of pocket for you, and the amount that is paid by the carrier. You have access to wellness coaches. You have a teledoc feature, as well as 24/7 nurse line support. When you visit the online website, there's additional tools available. You can also search for a provider within your network. Your ID card is printable from the website. They will also issue a new card. If you need to phone Florida Blue, you see the website and the phone number on the screen. Last year, if you recall, we added teledoc, which is telemedicine, to your plan. The way the telemedicine product works for you is you have access to a board-certified physician 24 hours a day, 7 days a week, and it's nationwide. With the telemedicine benefits, you have access to talk to a doctor via your phone, videos, mobile apps, so super convenient for you. Teledoctors can help you with many conditions, examples like cold and flu-like symptoms, allergies, pink eye, sinus problems, skin infections, respiratory infections, etc. So they can certainly assist you with those basic cold everyday needs to avoid you going into the actual doctor's office to have similar treatment. If a prescription is needed, they can also call that into your local pharmacy. Telemedicine is cheaper than visiting the emergency room or urgent care and is highly convenient. So definitely something for you to consider signing up for. These are the 3 health plans that are being available to you for next year, 2021. And the great news is they are exactly the same as today. Same plans, same coverage, same deductibles, same copays. Nothing has changed with the plan design. So it's just a matter of making sure this plan meets your needs when you sign up again next year. I'd like to review the plans with you at a high level so you understand how they function. The plan on the far left is 5782. This plan is the lowest in cost to you per pay period out of your paycheck. For coverage, you'll see the primary care physician copay is $35. The specialist is $65. If you were to visit the emergency room, it's $500. Urgent care is $100. You'll next see for the labs and x-rays, 3-tiered pricing. It depends on where you go as to your out-of-pocket expense. The first one, $0, represents you going to the doctor's office and then able to draw your blood or take x-rays at that appointment. Because you've already paid your copay, there is no additional expense for those services. If your doctor sends you to a diagnostic testing facility, they could charge you up to $65 for that lab work or x-rays. It depends on what the procedure you're having performed and the cost. The third tier, 0% AD. Anywhere you see AD stands for after deductible. For this plan, your deductible is $6,600 for an individual. This would result if you were in the hospital or if you were having outpatient surgery, that you would be required to fulfill the $6,600 out of pocket. The good news is once you have fulfilled that amount of money, that is also your out-of-pocket maximum. So your plan now would be 100% paid for all services for the rest of the calendar year. When you see the slash 13,200, this represents any other coverage level beyond single. So if you enroll your spouse or your child on the insurance, you both have your own individual deductibles of $6,600. If you are insuring a family or 3 or more parties, the maximum family exposure you have is $13,200. It would take 2 people to visit the hospital to be admitted to face those maximums. Moving down the line, you'll see that the complex image also has different fees. A complex image is an MRI or a CT scan, and these are not covered under the plan until you have satisfied your deductible. So you want to be careful where you go to have these services performed. If you were to go to a hospital, it would cost you several $1,000s to have this procedure performed. But if you go to a diagnostic testing facility, it may cost you $500. Same test, but lower in price. So this is where you'll want to call Blue Cross Blue Shield. You'll want to dive into your plan to see where you should go and how much it will cost you to visit those facilities, and then make the best decision for you. You'll see that all 3 plans contain life insurance. This is for you, the employee, and it's $10,000. Prescription medications are also by cost. It's in 4 different tiers. The cost for generic medicines is up to $20. For brand formulary, it's up to $40. For brand non-formulary, it's up to $70. And then the 4th tier medication is 20% of the cost, up to $250. All of those are for a 30-day monthly supply of medication. If you take a medicine every day, we call those maintenance medications. Examples would be blood pressure, cholesterol medicine, anti-inflammatories. You could select to do mail order, and you'll receive a 90-day supply of the medicine for the cost of 60 days. So you'll see the prices noted below for mail order. You'll save time and money by having it delivered to your doorstep. For the next item, you'll see that there is no referral required. You can go directly to a specialist to save you some time and money. You can also use these PPO plans to go outside the network if you wish. However, just be cautionary, you do have a different deductible and out-of-pocket maximum to satisfy when you use an out-of-network provider. For this plan in particular, it would be $9,000 as a deductible. You then pay 50% of the cost until you reach $18,000 as a maximum to go outside the Blue Options PPO network. The cost next to it results to family coverage. So the maximum exposure for a family would be $36,000 if you went outside the network. Certainly, we hope you stay within the network. The Blue Options PPO network is quite large, especially here in Florida. You have access to the Mayo Clinic, so you have great resources available to you should you need individual services. But certainly, you do have the flexibility to go outside the network if you desire. Now moving over to the middle, this plan is very similar to the one I just spoke to. However, there are a few differences. You'll see that the deductible is less. If I were to be hospitalized under this plan, my deductible would be $2,500. I then have a 30% coinsurance until I get to my out-of-pocket maximum of $4,500. Another difference is the urgent care is $75 for a visit as opposed to $100. Other than that, very similar coverages as you move down the line. Now the one on the far right is the richest medical plan available. It'll also cost the most out of your paycheck. It's plan 5771. With this plan, you'll see your deductible is less. If you were to be hospitalized, it's $1,500. You then have a 20% coinsurance until you reach your out-of-pocket max of $3,000. The maximum family exposure is $9,000. So it would take 3 people in your home to be hospitalized or need outpatient surgery to reach those plan maximums. You'll see that your copays are a little less. To go to the primary care doctor, it's $30. Specialist is $55. As you go down the line, another big difference with this plan is the complex image. If you needed an MRI or a CT scan at a diagnostic testing facility, it would cost you $200, and you would not need to meet your deductible before it was covered. You'll see if you go to the hospital, though, you still have to meet that deductible. So hopefully that helps identify and demonstrate to you the differences between the health plans available. Again, this is with Florida Blue, and your network is Blue Options when you go online to view your provider directories. To help you manage your healthcare plans a little easier, for those of you that elect medical insurance through your employer, you'll be able to access Balance Care. This is a health advocacy service. It's free to all of you that enroll in a medical plan. This insurance here can help resolve your claim issues. If you're getting a bill and you're not sure why, they can certainly help you do that research. They can help you locate doctors and hospitals within the network, secure second opinions, and frankly, just learn more about your medical conditions and services available to you. It is completely confidential. You can access them via the phone number listed here on your screen. For dental insurance, the good news here, there is no changes in your plan design, carrier, or price going into 2021. So it's only a matter of if you are enrolled in dental today, do you wish to change your coverage, or maybe hop into the plan for the new year. MetLife remains the carrier. You still have two choices available. We have MetLife Choice PPO or Platinum. With the Choice PPO, you have a maximum benefit of $1,000 paid by the carrier for your dental experiences. You have in and out of network benefits available. Keep in mind, if you go outside the network, you could be balance billed. An example would be your dentist office performs a cleaning, x-rays, oral exam. They charge $150 for their service. If MetLife normally pays 100% of $100 for those same services, your dentist can balance bill you the difference of $50. So before you have any dental work done, it's best to ask for an estimate for those services so you know your out-of-pocket responsibility before they are performed. With the MetLife Choice PPO, it does not include any orthodontia services. That's braces for yourself or for your children. So if those are of interest, you'll likely want to select the Platinum PPO plan, which does include orthodontia. It also has a larger maximum benefit of $5,000. You'll see here the website and the phone number to contact the carrier. Here is a great side-by-side of the two plan offerings. For the MetLife Choice, this is the lower cost option out of your paycheck. You'll see that the Type A services are 100% covered under the plan. Those are your cleanings, your x-rays, your oral exam every 6 months. Your Type B services are your root canals, fillings, things to that nature that may need to be performed. They're covered at 50% after you have satisfied a $50 deductible. Your Type C services are your big ones like crowns, bridge work, dentures. Those are also covered at 50%. And also, once you've met that deductible of $50 per person per calendar year. You'll see that there is no orthodontia benefit at the bottom. Comparison to the Platinum, your cleanings and x-rays are still 100% paid. The big difference here is your Type B services now are covered at 80% instead of 50%. So you have less out-of-pocket expenses when you have your fillings, root canals performed. Your Type C services match at 50%, but the difference here in orthodontia coverage is 50%. The maximum lifetime benefit for orthodontia is $1,000. So really you're just trying to determine, do I want the extra $5,000 in dental expenses compared to $1,000? Do I tend to have root canals performed and fillings where I would like to have the extra coverage? and do I need orthodontia benefits for myself or my family? That will guide you as to which plan you select. The network is exactly the same for the MetLife PPO plans. We'll now go into vision. With vision, also great news. There are no changes. It's the same carrier, same coverage, and the same cost. So again, matter of which plan is better suited for you. Aetna includes a large network of providers. You have Pearl Vision, LensCrafters, Target, Sears, JCPenney's, and many private eye doctors also take this insurance. You can visit the Aetna website to find a doctor's office close to you to make sure that they are in the network. Your exam is covered every year to get your eyes checked, so please make sure you're taking advantage of that benefit. You have allowances for contacts and for frames. While you can go outside the network, it is not recommended because the reimbursements are greatly reduced. This slide highlights the differences between the two plans you are offered. We have Vision Core, which is the lower price plan. You have the routine eye exam performed every 12 months at no copay. If you wear contact lenses, you have a fitting fee up to $55. If you use your benefits for glasses, you have $110 towards your frames, and then 20% off the balance. There are additional copays for your lenses that will depend on your prescription, and then you can also buy up additional treatments for your glasses, and those are noted in your annual enrollment booklet that you can see the prices for like scratch resistant, tint, things to that nature. For contact lenses, your disposable lenses are only receiving $100 in allowance. But if you use conventionals, you have the additional benefit of a 15% discount above the balance. If you'd like to upgrade to the Plus Vision plan, this is more expensive, but you do have richer benefits. You'll see that you still have the eye exam at no copay. Your contact lens fitting is no copay. Your frames have an enhanced allowance of $160. Your contact lens benefit also is enhanced at $160. One item to note is that the lenses that go inside your frames, any level of lens, the single, the bifocal, the trifocal, there's no additional copay for those. And you're also able to add additional treatments to your glasses for no extra cost. You will see the highlights of those two differences when you look at your annual enrollment booklet. Another difference with the frames is that with the Plus plan, you can have new frames provided every 12 months versus the Core Vision, it's only every 24 months. So if you tend to get new glasses every 12 months, you may find the Plus plan to be a little better option for you. If you wear contact lenses, you can certainly do contacts 1 year and glasses the next, but you cannot receive both services in the same 12-month period. Now we're going to talk about your flexible spending account. A flexible spending account is a way for you to reduce your taxable income and place money into either a medical reimbursement account or a dependent care. They function differently, and I will highlight the differences here in this presentation. For the medical FSA, you're allowed to use your pre-tax money towards any out-of-pocket expenses for medical, dental, vision, hearing, prescription drugs, and any of the over-the-counter medicines that may qualify. For 2021, you're able to put aside up to $2,750 into your FSA. You can put amounts anything up to that threshold. One exciting news as well is that we are increasing the rollover that you can utilize in your plan for 2021. The amount is going up to $550. So for next year, if you put in $1,000 into your FSA, you have to make sure you utilize at least $450 because $550 would roll over until year 2022 for your utilization. But keep in mind, if you don't use that $450, you lose it. So that is the risk by participating in this plan. The great news is you would receive a debit card. Upon enrollment, that you can start using in January. Your medical FSA funds are front-loaded, so the entire balance is available to you come January 1st. So if you were to schedule LASIK surgery, you could technically use all the funds in January and take the entire rest of the year to repay the company for your medical FSA. If you were to get into a pickle at the end of the year and you haven't used your money and no way to figure out how to do so, you can utilize the FSA store and purchase items that you tend to use every day. Examples would be sunscreen, Band-Aids, first aid kits. There's lots of options to select from, so it's definitely something to consider. Here's an example of the items that you can use your unreimbursed medical account for: prescription medications, over-the-counter items, co-pays, co-insurance, deductibles, eyeglasses and contacts that are out-of-pocket expenses for you, orthodontia, acupuncture. So there's a lot of items that you can use that FSA for. You'll notice in the booklet that I have prepared for you, I've given you a worksheet where you can plan out how much you're projected to spend next year. You can estimate how many visits you'll have with providers, prescriptions you'll have refilled, your estimated expense for dental and vision, so you can get your annual estimated cost for those out-of-pocket expenses. And then you can budget a little less and make that your annual election when you go online to submit. The other option to use your FSA for is for child care. This is a dependent care account. It functions completely different than the unreimbursed medical I just spoke of. You can put in up to $5,000 in this dependent care account, also pre-tax, but it is not available to be used on a debit card. This is a reimbursement account. So how it works is the money has to come out of your paycheck first. Then you can file a request to get reimbursed for your daycare services by using a form and providing a receipt. Your daycare expenses can be before and after school care. It could be summer camps, preschool. It could be true on daycare if you have a newborn or younger child that's not ready for school yet. You can also use it for elderly care. If your daycare is a consistent price per week or per month, you're able to remit the daycare form for the whole year and have it signed by the daycare provider. And then that way, once you get paid, we can send you a reimbursement, which can be either a live check or can be direct deposited into your account. Then you can use those monies to pay for your future weeks of daycare. If you're interested in enrolling in either of the FSA programs, when you log on to your Flex account, from the menu board, you will see the Paychecks Benefit account on the far left-hand side. You'll select to enroll if you are newly participating. If you already participate in the FSA, your 2020 election is going to roll over to 2021 if you do nothing. So please make sure that you go online and verify the amount that we have set up for you is what you intend going into next year. Now we'll talk about your disability insurance plan offerings. We offer short-term disability and long-term. Both provide you an insurance benefit to replace your income if you are not able to work because of your own illness or accident. Both will pay you 60% of your salary up to the thresholds of the policy. They are an employee-paid benefit. On the next slides here, you'll see the options. MetLife is the carrier. We offer a short-term disability policy in either two durations, 13 weeks or 6, which equates to three months, or you can go 26 weeks, which equates to 6 months. With either policy, you have a 14-day elimination period. So for example, if you're going out on maternity leave, you have the first 2 weeks is unpaid, and then the last 4 weeks, you would be paid 60% of your salary up to $2,000 a week while you're out under the care of your physician. New for 2021, we are offering long-term disability insurance. With this benefit, you either have a 90-day wait or 180 days, and that will correlate to the short-term disability policy that you enroll into. So for example, if you enroll into the 13-week short term, you'll do the 90-day long term. If you enroll in the short term 26-week option, you'll select the 180 option for long-term disability. That way you will not have a gap between the benefit payouts. You'll see that the monthly benefit here is up to $5,000. It is 60% of your salary, up to $5,000 per month. Life insurance is our next topic. So your company provides you life insurance of $25,000 to every employee, whether you elect any benefits or not, which is a wonderful opportunity. If you enroll in the medical insurance, you receive an additional $10,000 included with your policy. So you could be receiving $35,000 off the bat. We're offering you additional life insurance that you can purchase. It's through the Hartford Group. This is term insurance. It has no cash value unless you pass away. You'll see that the price of the insurance is based on your age. It gets more expensive as you get older. An example I have prepared for you is if a 43-year-old wants to elect $40,000 of insurance, you'll first take the $40,000 and divide it by 1,000 to get 40. Okay, that's how many increments we're buying of life insurance. We then times it by their age rate. Because they're 43, the price is 9 cents per $1,000 of insurance. This calculates to $3.60 a month. You'll divide it by 2 for your per pay period cost. With our life insurance product, you have to buy it in $10,000 increments. You can purchase it up to 5 times your salary or $1 million, whichever is less. If you are newly opting in for life insurance, you are subject to evidence of insurability. That means you're going to have to fill out an application and get approved for life insurance. Hartford will review your application, and if they accept, you will receive a letter and notification along with paychecks, where we will then change your deduction in the system and enroll you into the life insurance that you have been approved for. If you are currently participating in life insurance, you can increase it up to $10,000 with no EOI required. That's the evidence of insurability. For those of you that are brand newly hired and this is your first time enrolling in insurance, you are not subject to evidence of insurability initially and can select up to 3 times your base salary with no questions asked. Should you wish to go up to 5 times, that application would be required. If you would like, you can buy insurance for your spouse up to $20,000. It's in $5,000 increments, so 5, 10, 15, 20. The cost is $1.40 per 5,000. You can also get it for your children up to $10,000 and send $2,000 increments to 4, 6, 8, 10, and the cost is 20 cents per $2,000. So it's quite affordable. Do keep in mind that your insurance on yourself must be twice as much as your dependents. So if you wish to have $20,000 on your spouse, you need to have at least 40 on yourself. So if the company is now giving you the 25 and you have medical, you're already getting 35 with your employer in total. You'd have to get another $10,000 as a solo individual to cover your spouse at 20. We offer additional MetLife voluntary plans that you can opt in for. Accident insurance would provide you lump sum payments of over $150, over 150 covered events. Goodness. Some examples would include fractures, dislocations, a torn ACL, broken bones. Those would all qualify. You can also receive benefits if you're hospitalized due to an accident or illness. How these work is that you would file a claim with MetLife directly because they do not have access to your Florida Blue account to know that you've experienced a service that could qualify for payment. You would remit a claim and proof of your expenses, and then they would issue you the lump sum payments. In addition to the examples above, You can also receive payments for any ambulance services, emergency care, in an outpatient surgery, transportation, therapy sessions, x-rays, MRIs, or CT scans, all if they are related to your accident. The next is critical illness insurance. This policy helps provide lump sum monies to the individual to care for their loss of income and their medical bills because they've been diagnosed with a serious health condition. Examples could include cancer, heart attacks, strokes, diabetes. The lump sum payment is intended to help pay for your living expenses, your loss of income, your medical copays and deductibles, maybe child care or travel to those treatment facilities. With the MetLife hospitalization indemnity insurance, this would pay money to you if you are hospitalized. This includes an admission lump sum payment, along with a per day benefit based on the level of hospitalization that you have. If you have admission to an intensive care unit, it pays higher than a medical surgical floor. And then last but not least, we have prepaid legal insurance. This is administered by the Hyatt Legal Plan. There are over 14,000 attorneys nationwide who will help assist you with any court appearances, document reviews, money matters, estate planning, family law. There are no deductibles, no copayments, or waiting periods. The enrollment in this plan includes your entire family, and it is a full year enrollment. It is a great plan to consider if maybe you're looking to have your wills prepared, living wills, guardianship of your children in place. It's something that you could certainly do and pretty inexpensively. So what's next? I've gone through all of the great benefits that your company is offering to you. Now you're going to make your elections. The deadline for paychecks is 12/1. Obviously, the deadline for global outreach may be a little earlier in November to make sure that you complete all of your elections and track the completion before the portal closes on December 1st. You have 5 steps. First, you're going to log into Flex. You're going to review and update your dependent information. You'll then elect your benefits. You will review and submit and receive a confirmation statement. The next slides represent what you will visually see when you log on to the portal. You'll see from the menu bar after you log in, Health and Benefits. You can select the benefits at a glance if you'd like to review the options, or you can also refer to the benefit guide I have prepared for you. You will then select Begin. As mentioned, you will start with your dependents. You will add in anyone that you're wishing to add to your policies. We need their full names, dates of birth, social security numbers. You will then begin to elect your plans, and you will see a cost begin to calculate as you add different coverages to your buckets. You'll then be able to review your selected plans, make sure everything is in order. You can add beneficiaries and or remove, make changes. As you see here, at the very end, you'll have the option to submit your elections. You'll be receiving a PDF where you can then print your elections and save this copy for you. So that way when your first check comes in January, you can make sure that the deductions are correct, matching your confirmation statement. Please keep in mind that any benefits you elect now during annual enrollment will take effect on January 1st, and they will be in place for the entire year. The only way that you can make changes to your elections during the year is if you experience a qualified event. For example, if you get married, get divorced, have a baby, adopt a child, your spouse loses employment and therefore loses his insurance, those are examples of qualified events that allow you to change your coverages with your employer. You are limited to 30 days after that change has happened to let paychecks know of your desired changes for your benefit plans. We require proof of the documented change, and you'll remit your changes online. We will then facilitate that change for you. So just keep in mind, that's the only way you can change your benefits going into 2021. If you need assistance with your benefit elections, you can call into our health and benefits support line. We have representatives available 8 to 8 Monday through Friday. Here's the phone number and the options to select. You can also email the benefits team if you wish to do that method. Thank you for participating and joining today's session. I hope this helps you in making your selections for the new year. Thank you very much. Have a great day.